All right, so this is a knee arthroscopy, a 48-year-old guy. He is a competitive triathlete. I think he does Ironmans. So we're in the patellofemoral joint here. We just inserted the scope through the lateral portal. This is the undersurface of the patella, and then that articulates with the femoral trochlea just here. So his looks pretty good. He does not have much in the way of arthritis in his patellofemoral joint. I'm just going to suck out some of this stuff here, get a good view, just look around the undersurface of the patella for any hidden lesions. Maybe a little bit of wear just there. That's the most lateral aspect. So maybe some grade 1 change, you could say. There's lateral patella facet. So we're going to come over the condyle here and then turn the microscope to look down. That's the standard lateral plica that you see in pretty much everyone's knee. We're going to look past that into the lateral gutter and just give his little knee a little flick there to see if there's any loose bodies hanging out down there. There's not in him, so we're going to come back up, turn our eyes to look around, back in the patellofemoral joint, and then we're going to go into the medial compartment here, down in the medial gutter. Again, looking at the medial side, give it a little flick there, see if there's any loose bodies. Turn the suction on to suck anything out. He doesn't have anything there, so I'm going to move his foot onto the outside of my hip here to squeak into the medial side. And we'll just suck stuff out here. Do you guys get the spinal needle ready? So there's his problem. So you can see he has got a pretty good looking compartment, but he's got this big tear right there of his, it's mainly involving the, let's say the posterior horn of the medial meniscus. It extends into the area just there between the body and the posterior horn. And that is basically his tear. So I'm going to make my medial portal. I flip my eyes around here, and then just use my finger to sort of approximate where we're going to come in. We want to make sure we got good access to our tear there. Main thing here when I make my portal is I'm going to avoid the chondral surfaces of the medial femoral condyle and this anterior horn of the meniscus here. So I'm going to do this under direct visualization. Coming in with my spinal needle. So there you can see I'm avoiding the chondral surface and also the meniscus. And I'm going to sort of put this down to where I want to be. And I think that's pretty perfect there. It's going to give us great access to what we need to do during this case. So you guys have the 11 blade ready? So again, I'm still looking back here. I'm going to ask my assistant to take out the spinal needle. I've got my 11 blade, and this is going to go into the knee. Again, under direct visualization, we're going to make sure we miss that condyle. I'm just going to cut down. There's the meniscus. So I'm paying particular attention to avoid the meniscus here. Turn my blade upwards, sort of angling it towards the notch a little bit. And that's perfect. So I think that's exactly what we need. Let's get the probe. So after I've done this, I'm going to flip my eyes back around. And you can see he's got a big tear there. So he's 48 years old. We're gonna just trim this out. So when I go in with my probe, you can really see the torn meniscal tissue there. Comes right into the joint. Some other tearing there in the posterior horn. Otherwise, his meniscus looks pretty good. So there's not really anything for us to do here. So I'm gonna sort of bite this out right here and just make this stable for him, and he's gonna do real well. Okay, let's get the shaver first. We'll just start with the shaver here. I use a 3.5 millimeter shaver. I like the small one just so I can sneak it by the condyle. It's a little bit more precise, I think. So I turn it on to oscillate here. I'm making sure I avoid the condyle. And then I just turn the suction on, and it just brings all of this unstable tissue into the shaver. Yeah, get that ready.
Can you get the werewolf? Yeah, werewolf. That's why it's kind and take the block out. Yeah, you got it.
Joel, just hold this for 1 sec. The camera, just right there. So this does most of our work. But we're going to take the bucket biter next, and I'm just going to clean this up down to a stable rim. And again, we're avoiding the condylar surface. I think that's probably one of the most important things in these cases, so you don't do any damage to the surfaces. Let's have the bucket. So I'm going to start right around here. So that looks pretty good. So this is the most posterior aspect, right at the attachment. We want to make sure we don't destabilize the meniscus there. But there you can see we've done the majority of our work. Let's get the shaver back in. Can you pass me that? Good. So we got a bunch of loose bodies now in the knee. We're just going to turn this on to oscillate. So just get most of these out. Just hold that for 1 sec. So I'm just going to go over the area that I've trimmed here just to sort of take out any edges. I think that's pretty good. So this area here is also torn, but I think it's going to be easier for us to access this from the other side. So once I'm done with the rest of my scope, I'm going to switch portals and come in from the lateral portal, which is going to give us more of a direct shot at this tissue here, and we can just sort of trim that up to make it look a little bit better. But for the most part, most of our work is done there. So now we're going to come into the intercondylar notch of his knee. And there you can see his ACL and attaching to the lateral wall there. I'm going to come by the ACL and just put the leg into a figure of 4 position. So give me the leg or the stool. And then this is the lateral compartment. So you can see this is what a normal meniscus looks like. No tearing. Lateral compartment looks very, very good. Maybe got a little bit of fraying there along the edge. So I'm just going to get the shaver into that side and maybe just clean this up just a touch. So I'm just going to hover my shaver around the rim here and just allow any of these loose edges to be pulled in, making sure that I avoid the condyle. So I think that looks pretty good. I don't think there's any more work to do here. Very good looking knee other than that tear on the medial side. Posterior horn lateral meniscus looks very good as well. And his condyle surfaces are very much intact. So you can see, looking up and down his femoral condyle here, there's not really any arthritic change. He's got a very good looking knee. So I'm going to switch my camera around here. There's his ACL again, pretty good view of an intact ACL. Then we're going to go in here to the medial compartment again. So I'm going to take the scope out of the knee, put it into the medial side, and switch my view around. So this is looking through the medial portal. Can I have the biter, guys? The bucket? Yeah. So I'm going to go in with my bucket now from the lateral portal. Just sneak it in here. We're just going to clean up this little edge. Okay, let's get the shaver. So it looks a lot better than what we started with. The last thing I'm going to do here is come in, start from this side, but I'm just going to come in with our radio. This is called the Werewolf. It's by Arthroscopy. I come in here from our same portal laterally, and I'm just going to run this by. This is a radio frequency probe. I'm just going to run it around these edges just to stabilize any sort of loose border of the meniscus. That looks pretty good there. So I'm going to switch portals again, go back from the lateral side. So this is the portal we started with. It's a lateral portal. And I'm just going to go back in with my probe and just touch up that tissue there that we took out. Hold that. You can see that's us after we've performed a partial meniscectomy. We got a little piece of that on the end of our scope. But that's it. That's the end of our meniscectomy. Let's get the probe, guys. So we've trimmed it out there down to a stable border. Just going to get my probe in. That's stable, stable. Stick it in the back here, also stable. And there's not really any other torn tissue there. So I think he's going to do real well. And that's it. So we finished the case where we left off in the patellofemoral joint. Everything looks good there. And that is it. Partial meniscectomy of the medial meniscus.